What would be age appropriate to start talking, especially globally, because our children are, sold in marriages at the age of 10. And the other part of my little question is, how do you deal with the senior population who are divorced or widowed? Just a little question.
Thank you.
Thank you, and God bless you.
Thank you. Pablo, can I start with you? Young person, issue of age. When should we start talking about this?
Well, we should start talking about it since the first moment that someone can understand and can just, what we work for is to have the information at our own level, in our very own moment. And it's very important how open you are in talking about it, and it's very important how you handle it, because how you handle it is how they are going to receive it. If you are talking from fear, they are going to receive fear. If you talk from freedom and from openness and from being honest, then that's what they are going to take.
A really
also.
good point. It's how you approach it rather than some steadfast rule. And the other end of the spectrum, those widowed or widowed by the disease. JP, as a Anglican minister, a pastoral role, do you go out and find the situation, and how do you reach out?
I think the most important lesson for us in terms of setting our priorities and programs and how we engage with people living with HIV or vulnerable to HIV is that HIV will not ask of you the question, how old are you? It will not ask of you the question, what is your skin color? It will not ask of you the question, what is your sexual orientation? It will not ask of you, what faith do you belong to? It will simply ask the question, is there an entry point? That's it. And we have to, from the youngest possible age, and as long as people can still understand, speak to them about where the entry points in their life might be, and try to help them to make sure that we don't offer HIV an entry point.
We have on the clock 5 minutes. I don't know if I can beg another 5 minutes from the organisers, but if we can, that will probably give us a chance for sort of 2, 3 maybe quick questions and answers. So if I could have the first question of those 3 from lady over there.
All right. My name is Winnie Suruma. I'm from Christian Aid, based in London, UK. And I'm also a person living with HIV for almost 25 years. But I was just wanting to really find out from the panelists, as people living with HIV, for those living with HIV, what is it we are going to be asking at the international conference moving forward? Because I feel that we've literally done this. How many times? What number of conferences this? There is still so much to do, but we have a lot of stuff. But what is it that is different that we're going to be asking at this conference? Because I feel that I'm running out of things to say,
A very good question. Yes. Yvette, it's a tough one. Can I turn it to you? You've bashed heads together. What do we need to do?
I'd first like to applaud all the brothers and sisters that are both activists and caregivers and pastoral care providers, and all of you who are here who are living with HIV. I'd like to applaud you, if that's... I think we should give it to them a little bit better than that, because they're the champions. I think we should do a little bit better than that. You are the champions. You live with the virus. And we thank God for your courage and your tenacity and your determination. And God bless you. God bless you. And I would say to you, sisters and brothers, who are the ones who are living with the virus and are caring for others who are living with the virus, not only should we applaud your strength and your determination and your tenacity, but I think it is right now to ask the real questions, particularly because the atmosphere is full of conversation about health care. We need to understand that there is a disparity that exists out there. There are people who benefit from chronic illness. There are organizations that benefit from chronic illness. And sometimes when those organizations are simultaneously suggesting that they are looking for a cure, understand that money is not made when there's a cure. Money is made if we can keep a group of people ill for as long as we possibly can and in need of medical intervention. That's the way money is made. I think it's time to hold people's feet to the fire about finding a cure and finding a real sustained intervention that will eliminate and eradicate this pandemic in our lifetime. I'm encouraging you to keep fighting and keep asking the hard questions.
In fact, Maida, if I can ask you to pick up on that, what does the faith community need to do and say in the following week so the AIDS conference, the international conference, is not a talking shop?
I think first of all, faith communities should allow people like myself, an ordinary person, to speak openly about the HIV status without judging us and to support us and tell other people it's okay to have HIV. We are here to support you. And secondly, to answer that lady's question also, I think we need more people to speak openly about the HIV status. When I look around, I don't see many Muslim people at this gathering, so I feel a bit alienated as well. So we should really include all faiths, not just one side of the faith. Yeah. Because even for myself, I have attended many interfaith conferences. And again, I'm always the only speaker at these gatherings. And yet, there are many Muslim people out there living with HIV. But they are too afraid to come forward and say, I am HIV positive. And furthermore, I think stigma is a thing that is really killing us, not HIV. So interfaith people, they should really work on that. See and try and find a way how they can do away with stigma. Because at the end of the day, you can live a long life with HIV, but it's the stigma that is killing us, not the virus.
Thank you, sister. Just two more quick questions.